Thank you all for joining us. This is our University of St. Augustine DPT info session. I'll be monitoring the chat, so if you have any questions along the way, just either turn on your mics or send them in the chat. If not, we can go ahead and get started.
Thank you, Miss Stephanie. I'm going to load up my PowerPoint, and if you guys can let me know that you can see it on your end.
Yes, we could see it.
Excellent. Very good. Well, thank you guys. I appreciate you all being here this evening to hear a little bit more about the University of St. Augustine for Health Sciences and our fabulous Doctor of Physical Therapy program. I was just telling Stephanie that I was on campus, actually the UTSA campus last week for the Health Professions Fair, and had a wonderful time. Spoke to quite a few pre-PT students, pre-PA students, pre-OT students, even some speech language pathology students that are going to be coming up. So had a great time, and I was excited because I thought I would probably see a few people here tonight that maybe I spoke to on campus. But if I didn't see you, we're going to hopefully give you some more confidence about being admitted to a Doctor of Physical Therapy program. We continue to receive strong applicants from the UTSA campus to both our Austin and our Dallas campus for our Doctor of Physical Therapy program. So I'm always excited to update you guys on the things that you need to be working on now to be competitive once you get to the point of applying to a PT school. So again, thanks so much for being with me. If you guys have any questions tonight as I go through the PowerPoint, please type those questions in the chat box. So if you want to speak it out loud, that's fine too. But let's get started with hopefully getting you guys prepared and admitted to a PT school. One of the first things I like to start off with is to encourage you guys that you've chosen a great future career. I like to kind of give you guys an idea about what the median income is for physical therapy folks right now. Then also talk to you about the high job growth for physical therapists. So right now, the median income for PTs is almost $96K, almost $96,000, which is not a bad salary for a career that you're going to love. And my prediction is that the median income is going to increase because there's such a need more than ever for physical therapists in so many communities. So you guys have picked a great career. I know you're not going to be doing it just for the salary, but it's nice to know that you're going to be making a pretty nice income once you get through at UTSA and once you come up to a PT school and you get out there in those communities. Down at the bottom of your left, if you notice the high job growth for physical therapists, this is going to continue. It goes up right now to the year 2030. But as I mentioned earlier, there's such a need for not just physical therapists, but all of the programs that are listed there, occupational therapists, speech language folks, nurse practitioners, physician assistants, all those healthcare careers, there's a dire need for folks. So I like to start off with this slide to kind of let you guys know that no matter if maybe there's a hiccup as an undergraduate student at UTSA, or maybe there's a course that is a little bit more challenging than maybe your typical course, maybe one of the prerequisites that you're taking, I would encourage you to stay resilient, stay strong, because again, the future is very bright for you guys. So again, take care of that undergraduate part. Come on up to a graduate school, to a Doctor of Physical Therapy program. Everyone is going to prepare you for the licensure exam, and then we can get you out there into those communities to take care of all of the people that need PT work done on them. When I was on your campus last week, I was very surprised that a lot of people were very familiar with the University of St. Augustine. And I think maybe because they've met some of our alums that are out in the community in San Antonio, or maybe when they've done some of their observation hours, or maybe their internships, they have met some of our alumni because we've been around for almost 50 years. And we only do graduate health science programs. So we don't award any bachelor's degrees. We only have graduate degrees at the university. One of the things that most people think about when they hear about St. Augustine is that we do a lot of hands-on teaching, a lot of rehab focused type teaching, a lot of clinical experience. So I'm going to show you guys later on a video of one of our simulation labs at, I believe, at our Austin campus to kind of give you an idea of the fact that at our university, for example, if I was your professor and we were done in a lecture setting, we would immediately walk across the hall to what's called a simulation lab. And what you learned in the classroom, you would immediately apply to a real person. We hire people in the community that act as patients. So again, what you've learned in the classroom, you would practice, you do mock simulation on people. We think this is a good way to produce physical therapists and speech language pathologists and PAs and occupational therapists is to practice, because what it does, it gives you a lot of confidence before you go out to do your clinical internship. You learn a lot about bedside manners, about patient care skills, and all of this is done before you go out to do your clinical residencies. And we'll talk about that in a little bit. But again, at St. Augustine, most people think of us, again, as the hands-on teaching university. A lot of clinical experiences, a lot of practice, because again, we think this is a good way to produce allied health clinicians. Another really awesome thing about St. Augustine is that we have 5 campuses across the country. So if you would like to leave Texas, we have that option for you. But if you want to stay in Texas, that's a good option for you also. But the name of the university, St. Augustine, comes from the city of St. Augustine, which is in Jacksonville, Florida. That's where the name comes from. So we have a campus in St. Augustine. We have another campus that's in San Marcos, California, that's in the San Diego area. And then we have another campus down in Miami, Florida. Most of the students that have applied to St. Augustine from UTSA seems like they want to stay in Texas. So if you want to, you have an option. Austin, just right down 35, not too far from San Antonio. And then we have a campus up in the North Texas area in Dallas. Actually, it's in the Las Colinas, Irving area, if you're familiar with Dallas. But if you ever get to the point of applying to St. Augustine, if you guys are familiar with PT-CAS, the common application for PT school, you have the choice of applying to any one of the campuses. You can choose one. If you're open to attending more than one campus, you just let us know, and then we will process your application that way. But again, Austin, right down 35 for you. And then if you want to come up to North Texas, it would be the Dallas campus. This particular slide shows you all of the other programs that we have at the university besides the Doctor of Physical Therapy program. So we have a master's program in speech language pathology. We have 2 types of programs for OTs. We have the Master's of Occupational Therapy, the Doctor of Occupational Therapy, and then, of course, the Doctor of Physical Therapy program. And then we've just added a physician assistant program that's at our Austin campus. I like to put this slide up because at St. Augustine, we also teach in a interprofessional type of curriculum, which means that as a physical therapy student at St. Augustine, you're not just going to be taking classes with physical therapy students. You will be taking some classes with speech language students. You may be taking classes with OT students, PA students, or nursing students, because in the real world, and if some of you guys have already gone out to do some observation or shadowing hours, you've noticed that a lot of healthcare is being done in a team setting, which just means that you're not just going to be in a room with a physical therapy person. You may be handing a client or a patient to a speech language person or to a PA person. So we have you guys learn the language of other professions while you're in grad school, so that when you go out into the real world, you'll have a really good idea of what another person is doing that you may be handing a patient on to. So it gives you, again, more confidence, more experience, because, again, you're not just going to be working with PTs. You may be at a hospital or at a clinic or in some other type of setting where, again, you're going to have to be handing a patient off that's not going to be a PT. So we give you that experience at the grad school level before you go out into the real world. Another neat thing about the University of St. Augustine, with us being a private university, is that we have 3 start dates per academic year for our PT students. Not sure if we have freshmen in the meeting tonight, or sophomores, or juniors, or seniors, but as you get closer to applying to PT school, you're going to notice there are some schools that only have 1 start date per academic year, while others have more than 1. So we have 3 because we want to give students as many positive options when it comes to starting PT school. So we have a class that starts in January of each year. We have another class that starts in May, and then another class that starts in September. So what you guys have to do now, depending on your classification, is start thinking about when are you going to be graduating from UTSA, and when are you planning to go on to PT school. Some people take a summer off after they graduate. Some people take a gap year. It's fine either way, but we like to kind of have an idea about it because each one of these start dates has a application deadline date. So you'll have to kind of be aware of that. But the benefit of having 3 start dates is that, let's just say, for example, you wanted to start in September of next year. You submitted your application, you indicated you were going to start in September, but let's just say something happens and you're not able to start in September. What you would do is basically just let us know that you're unable to start in September. And if you can start maybe the following spring in January, just let us know and we will update your application. So you won't have to submit another application. But again, if you're looking at a school that has only 1 start date, if you're not able to start the date of that class, you would have to wait another year before you would be able to start. So keep that in mind as you start looking, because again, there's some schools that have more than 1 start date, while others have just 1. You guys already know the answer to this question because you're members of the Pre-Physical Therapy Society at UTSA, but I always like to just put this slide up just to kind of give you guys a reminder of what is physical therapy. Of course, you guys will have the option of treating patients from all types of ages, all types of lifespan areas, all kinds of different populations. And then you probably have seen, if you've gone out to do any observation or shadowing hours, you notice that there's a lot of different settings. You could be doing inpatient settings, you could do outpatient settings, community settings, and then there's a lot of specialized areas as a physical therapist. So I'm hoping that you guys have started maybe going out to discover maybe whether you want to do geriatrics or pediatrics, or maybe you want to focus on orthopedics or sports. And the reason why I'd like to mention that is because as you start transitioning into a graduate doctor of physical therapy program, we're going to be asking you, what area do you think you want to do your clinical residencies on? Because I'm going to talk about that later on, because at the grad school level, you don't have to find out or place yourself. We will take care of that for you. But all we need to know is, where do you want to do your clinical residencies and what area do you want to specialize in? So it's okay if you haven't made up your mind yet and you don't know what area you want to focus on as far as the specialization area, but start thinking about that as you go out to do observation hours or shadowing hours, or maybe you're working at a clinic, because we are going to want to know that as you progress in graduate school, so that we can place you into those clinical residencies. And then, of course, when you get to graduate school, I have to talk to you guys a little bit more about curriculum and what to expect once you get to a graduate doctor of physical therapy program. Of course, you're going to be doing more classes in anatomy. So I'm hoping that you enjoyed your undergraduate anatomy classes, if you've taken those already, because you're going to be seeing more of that once you get to the grad school DPT program. Then, of course, lots of clinical courses, because, of course, you guys are going to have to learn about touching people and knowing the different movement parts of the body. So a lot of the curriculum is focused on that. And then at the Doctor of Physical Therapy program at St. Augustine, you guys will be doing 3 full-time clinical residencies or clinical rotations, some people call them. So it's going to be in a variety of settings. So again, as I mentioned earlier, start preparing yourself for that, because this is the way the clinical education requirement works at St. Augustine. So you're not going to start this at the beginning of your Doctor of Physical Therapy program. We have to prepare you for the clinical experiences. We have to connect you to our clinical education department. They're going to be coming in to talk to you about it. But when you get to this point of your clinical residencies, you're not going to be on campus. You're going to be out 40 hours per week. And if you notice, you don't start the program, the clinical part of it, until your 5th, 7th, and 8th term in your Doctor of Physical Therapy program. And I'll talk to you guys about the length of the program later on. That we have both a residential and then a flex program, which again, I have a separate slide for that. But again, the clinical part of the curriculum is super important. By the time you guys get to this area of your Doctor of Physical Therapy program, you're going to be pretty much a clinician. You're not just going to be doing shadowing types of situations. We're going to be teaching you, preparing you, getting your confidence level up so that when you get to do this, you're going to be really, really knowing what you're going to be doing and really feeling more like a clinician. Okay, Stephanie, I'm going to take a break just for a second to see if anyone has any questions or if anyone has typed any questions in the chat box before I go ahead.
We're good in chat questions unless anyone wants to use their mic to ask a question. Does anyone have a question?
All right, let's continue on then. Some of you guys that have done your homework on St. Augustine probably know that we have 2 different Doctor of Physical Therapy formats. We have what's called a residential program. This is our full-time accelerated program where people basically move to Austin or Dallas. I'll just use the campuses here in Dallas, in Texas, to give you an idea. So they come to the area where the campus is located, and it's on a full-time basis. So basically, your life becomes physical therapy school. You know, the students are typically not able to work if they do the residential program because it's an accelerated program and it's a full-time program. So if you notice, it's 8 trimesters, and the full-time residential program is 2 years and 7 months, which means that your life is PT school for that entire period. If you notice the course load, you're taking almost 20 credits per trimester or per semester. So I would consider that to be a full class load, particularly for grad school. So that's why you're not able to work, because you're so busy with not just coursework, but doing all types of other things that's related to the curriculum. And then you're on campus pretty much every day during the week. And then the class size for each one of the start terms. Remember, I mentioned to you guys, there's a class in January, another one in May, and then another one in September. We have almost 75 seats each start date, each term, which is a lot of seats because, for example, I attended Texas Women's University, and we had only 1 start date per year. And we had, at that time, we had about 50 seats once a year. So St. Augustine has about 75 seats 3 times a year. So about 75 seats in May, another one in September, and another one in January, which means that we have lots of seats, but it's still competitive because of the reputation of St. Augustine, and then the fact that you guys are finding out that PT is a wonderful career. So pretty good bit of applicants, but it's less competitive because we have more seats that are available. And of course, the degree is the Doctor of Physical Therapy program. And then if you notice to your right, we have another format that's called a flex program. This is kind of a weekend program. So this is for people who, for whatever reason, can't come to graduate school on a full-time basis. Maybe they have to work while they're in grad school, while they're in the DPT program, or maybe they have a family, but for whatever reason, they can't come to school on a full-time basis. So it's part-time. So basically, you're on campus every other weekend to do the clinical, hands-on type things that we have to see you to educate you on. If you notice, it's less class loads, though. It's only 8 to 12 credits. You're there on the weekends, but it takes longer to finish the program. Typically, it takes about, instead of 2 years and 7 months, it takes about 4 years to finish the part-time program, the flex weekend program. But again, I'm glad that we have both formats. You guys know yourselves better than we do. So you would just pick the one that is the best fit for you. And that's the way you would apply to the university. But again, it's the same curriculum, same courses, same degree, doctor of physical therapy program, except one is accelerated and one is more of a slower pace, less class load. So you pick the one that's the best fit for you. Let's talk about those admission requirements, because again, we want you guys to be admitted to a PT program. So these are the things that we would be looking for. Pretty much any doctor of physical therapy program is looking for some of the same common requirements. Of course, we're going to be looking at your undergraduate degree from UTSA. Great thing about PT school is that you can come to us, have graduated from any undergraduate degree. It doesn't matter whether you come from a exercise science background or kinesiology or what have you. Most important part of the degree is having the prerequisites within your degree plan. So any undergrad degree is fine, but the prerequisites are the most important part, and we'll talk separately about the prerequisites later on. Of course, everyone talks about grades. So a 3.0 gets your foot in the door. But of course, the higher your grade point average, the more competitive you're going to be. So at St. Augustine, we look at a couple of different GPAs. We look at your overall GPA, and then we pull your prerequisite courses from your transcript, and we calculate a separate GPA with just your prerequisite courses. And then that's how we look at the GPA as one of the requirements. And then you guys have probably heard about the GRE exam. If you haven't, you're going to hear about it as you continue with your degree plan at UTSA. Every school has a particular score that they're looking for you to have when you take the GRE. And it's a typical standardized exam. So there's 3 sections on it. The 2 sections that are the most important are the verbal and the quantitative section, or the math section. What schools do is they combine the scores and they let you know a kind of a score that they're looking for. So at St. Augustine, a 294 is a score that we're looking for. And then we also look, of course, at your writing score, which a 4 is going to be what we're looking for, because there's quite a bit of writing that's involved with graduate school. So do your best with that. And then, of course, many of you have probably started your observation hours. Some people call them volunteer hours. Some people call them work hours in a PT setting. So minimum 80 hours, but I'll give you a little kind of heads up. Whenever a PT school says minimum when it comes to a requirement, you always want to go above and beyond. So at St. Augustine, 80, but typically most of our students will have somewhere between 100 and 150 observation hours. So you can have more if you'd like, and if your schedule permits you to do more of those observation hours. But typically, most of our students will have about 150 hours. But what we like to see more than anything, rather than a lot more hours, we like to see a variety of settings when it comes to your observation hours. So, for example, if you can schedule maybe an inpatient setting or an outpatient setting, that is going to make you much more competitive. And then also, if you can maybe be in a setting where you're seeing different populations of people. So maybe you're working with adults, maybe you're working with children. If you can do that, that's going to not only make you competitive when you apply to PT school, but it's also going to help you when you actually get into a graduate DPT program, because so much of the teaching is based on your experience, what you've seen while you've gone out to do those hours in a PT setting. So if your schedule permits, try to do that as much as you can. And of course, we're going to be asking for letters of references. 2 letters of references we prefer comes from a PT clinician. So that's going to make you more competitive. So when you go out to do those observation hours, make sure you have the people that you're working with get to know you. Get to know your story. Why do you want to become a physical therapist? What are you going to be bringing to the programs? Just general things like that. And then you can ask maybe a faculty member at UTSA, or maybe someone you're working with, maybe an advisor, to write a third letter of reference for you. But again, let people see your soft skills, all the great things that's going to make you a wonderful physical therapist, all your wonderful bedside manners, all those things like that. Let them see that, so that when they write that letter of reference for you, it's going to be a strong letter of reference. And then we also want to see a copy of your resume, because we know that you're more than metrics. You're more than a grade point average. So we want to see all the other things you've been doing, perhaps at UTSA, or some things you've been doing in the community, maybe in San Antonio or in your hometown. But some of the things that you want to include on your resume, if your schedule permits, is your community service. Maybe you've done some community service, you've done some volunteering, you've done some extracurricular activity type things that we maybe can't see from the PT application. Those are the things that we want to see on your resume. And then finally, your statement of purpose, or some people call it a personal statement. This is letting the PT program know, what is your unique story? Why do you want to become a physical therapist? What is bringing you to this career? Is it a personal story? Is it maybe something you saw? Maybe a relative of yours had physical therapy work done, or maybe you had physical therapy work done on you. But whatever your unique story is to why you want to be a physical therapist. And then the second part of the personal statement is that you have to do your homework on each PT school that you're applying to, because each PT school has their own reputation, their own mission. So you have to do homework on each school. So for example, at St. Augustine, maybe you enjoy hands-on teaching. Maybe you enjoy rehab-focused curriculum. Maybe simulation, working with like mock practicing with patients. But each school has their own reputation. So you'll have to include that on your statement of purpose, because we're wanting to know, every PT school is wanting to know whether we are a good fit for you and whether you're a good fit for us. That's what we're looking at when we get to the point of interviewing and things like that. But remember, when it comes to admission requirements, at St. Augustine, we look at all of our applicants holistically, or we look at people that are well-rounded. So grades are important, but it's not the only thing that we're going to look at, because sometimes people have high grade point averages, but that doesn't tell us that they're going to be a good PT person or a good PT student. We need to see more than that. That's why we also want to see your personal statement. When we interview you, we want to see your bedside manner skills. Because remember, if you're going to be a physical therapist, we assume that you like people, that you enjoy helping people. So we have to see those kind of skills when you do the interview. So it's great to have all the other things that I have here, but we're looking at everyone kind of well-rounded. So make sure you visit as much time as you can with each one of those, and that's going to make you super competitive as you get closer to applying to PT school. While these load, Stephanie, let me know if there's any questions in the chat box. I know I kind of went in detail about the requirements a little bit more, because I wanted to make sure you guys were on the same page with me as far as requirements and things like that. Any questions in the chat box?
We still don't have one in the chat box, but I have a question about the Flex program.
Sure.
So they go on campus every other weekend, but are they still learning remotely through Zoom or like pre-recorded lectures? Like, are they still actively learning during those 2 weeks?
Absolutely. Anything that we can share, and our technology is very advanced when it comes to what we're sharing distance wise, but they're doing all those classes that we can share distance wise, because there's some courses, Stephanie, that we don't need to have you guys in a lecture setting. There's just no need to do that. So all of the courses that we can offer in that format is done when the students are not able to be on campus. And then the every other weekend covers a lot of the clinical part of the curriculum. And then we may have students in a classroom setting on a weekend. It might be a Friday, Saturday, or Sunday. And if need be, it would be in a classroom setting. But all the other times, though, during the week, everything is done distance ed. It's in that type of format. Because again, there's so many courses, particularly in the Doctor of Physical Therapy curriculum, that there's no need to be in class. when you're working at that pace, at that flex pace, which is a slower pace. So it works really, really good. And it seems to be a good format, again, like I mentioned, for students who just want to take a slower pace. And it's good for students that are kind of in the Austin or Dallas area, because the commute, although we have students commuting from much farther than San Antonio to Austin for the flex program, because again, it just seems to be a good format for them. But to answer your question again, everything is distance ed during the week, and then weekends are all the face-to-face classes.
Okay, I thought they just put a pause on their education and then went back to in person.
No, it's continuous, and again, you're taking courses every semester or every trimester. So it's the same courses that everyone else is taking at the residential program, but just a slower pace and a different format.
Okay, and then we do have a question. It says, what would be the difference between inpatient and outpatient in regards to ages? Because in an outpatient, you can see a variety of ages.
Well, that's true when it comes to outpatient, but inpatient, outpatient, again, if the person is staying, they're just not coming for their therapy and leaving that same day. That's kind of the outpatient. But there are some settings, particularly at hospitals, where a person is a patient. They're inpatient, so they're not just coming for one day. They may be in the clinic or the hospital for a week. So that would be an inpatient setting. But again, it just depends on, hopefully you guys, I think it's getting a little bit better with hospitals and clinics and PT settings allowing you guys to come back. I know during the pandemic, it was difficult for students to locate some settings where they were allowing students to come in to do observation hours. But my understanding is that it's getting much, much better. But it seems like a lot of settings, they're more open to doing outpatient observation hours with students rather than the inpatient ones. But again, it seems like it's getting a little bit better. But if you're not able to locate an inpatient setting, it doesn't mean that we're not going to consider you for the program. So if you're only able to get outpatient, that's fine. Submit that with your application. But again, if you're able to locate any inpatient type setting and they allow you as a student to come in, take advantage of it. Take advantage of it if you can.
I guess like a follow-up would be, you were mentioning like different settings.
Mhm.
When you're in an outpatient clinic, you see like geriatric patients and peds patients, but how do you, I guess, in paper say that I was shadowing at this outpatient clinic and worked with geriatric patients and peds?
Well, you don't have to do it by paper. We're going to be confirming your hours with the supervisor, with the person that you've been working with. So you can kind of keep your own records because, again, sometimes you might have to remind the person who's going to be confirming that with us. But again, you don't have to do that officially yourself because everything now is being done electronically. So you're not going to have to submit any papers to us or PTCast, the Common Application folks. But some students will do that just to keep their own records. But we'll be confirming that with the person that's working in the clinic that you're at.
Okay. That was the last question in the chat.
Okay, good questions. Let's talk a little bit more about those prerequisite courses. We're very familiar because, again, as I mentioned earlier, we've received applicants from UTSA over the years. So we're very familiar with the prerequisite coursework, but these are the courses, if you submit an application to St. Augustine, that we would need to see on your transcript. So very straightforward when it comes to again, chemistry and physics and biology, anatomy and physiology. And then, of course, you guys do social sciences. You don't do as many as the OT applicants, but these are among the courses that you can pick from. So again, you don't have to take 9 credit hours just with psychology. You could do 3 credits with sociology, 3 with psychology, 3 with anthropology. I just like to list this to give you an idea where the typical social sciences classes are done at. And then you're going to do, of course, 1 credit of medical terminology coursework. I always like to mention when I put this slide up is that even though you guys are at a 4-year university, if you want to take a prerequisite at a community college or a junior college, it's fine. We don't put an asterisk next to your name if you take a course at a community college. Of course, we would prefer you take it at a 4-year university, but because of the tuition being so much lower at a community college, I can understand that. The only thing we mention, if you do take a class or a course, particularly if it's a prerequisite at a community college, make sure you feel real strong about that course. Because once you start grad school, and nothing against community colleges, but once you start grad school, um, professors are not going to go back and review. So we know the rigor at a four-year university. We're not as familiar with the community college rigor when it comes to prerequisite courses. But again, you're more than welcome to take it. We will definitely accept a community college course or a junior college course, but just feel strongly about that prerequisite if you do take it in another setting. And to give you guys an idea, we're just going to assume that you're going to transition from an undergraduate bachelor's degree on into a doctor of physical therapy program. So at St. Augustine, to give you an idea about, let's just start with student housing. There's no housing on any one of our campuses, but we have a person that's in our student services support area that helps students transition to housing near our campus. So if you're not familiar, maybe where our campus is in Austin, it's in South Austin. But if you want to live near the campus, there's apartments, and this person would help you locate an apartment, or perhaps you might be looking for a roommate. They would help you locate a roommate, a student that's also looking perhaps for a roommate. And then on the other side, when it comes to student life, one of the things that we start our students the very first semester is starting to network. You have to start networking with people that you're going to be working with when it comes to your career. So our students, they become members of professional organizations. Or so, for example, as a PT student at St. Augustine, you're going to be attending the state PT conferences, because we need for you to start meeting people, meeting our alumni, start networking with your future colleagues. The great thing about Texas, with all of the wonderful cities, San Antonio, Houston, Dallas, a lot of the national PT conferences are held in Texas. So some of our students are able not to just go to the state conference, but also the national conference, which is really neat because, again, you're able to do more networking, starting to meet people, so that when it comes to your employment years later, you're going to already have your foot in the door in so many different settings. And then, of course, at each one of our campuses, our students are very involved in a lot of community activities, a lot of volunteering. So know that that's something that's a big part of St. Augustine. We have pro bono clinics at each one of our campuses. So we know that that's something that we enjoy doing, being able to help people who can't afford physical therapy. So we see people on each one of our campuses to help the community out when it comes to that. And then facilities, I'm hoping that you guys, I don't know if you guys ever maybe do a group visit to PT schools, but we would welcome you to come. If not this year, maybe next year. If I'm talking to maybe one of the future club officers, we would welcome you to come as a group to visit the facilities, or if you want to come individually. If you're coming to Austin or Dallas and you want to visit our campus, I'll give you some information about that. I'll share that information also with Stephanie, so she can share that with you guys later on as a club. But these are the things that you would see. We are very proud of the fact that we have virtual dissection tables at the campuses. We do a lot of telehealth type equipment in our classrooms. As I mentioned earlier, we have the pro bono clinic, and the video that I'm going to show you, it's our simulation lab that we have at one of our campuses, where we do all of the clinical practicing. So again, if you guys are open to visiting one of our campuses, just let us know. Let us know what you want to see. If you want to maybe meet some current students, or if you want to meet faculty members, or maybe talk to someone in the financial aid office about paying for graduate school, just let us know, and we will get you guys situated with that. And of course, this is one of the things that I was very much needing to hear about when I was in your shoes before I went on to grad school. I needed to know what resources were available for me at the grad school level, because I was not blessed with having a rich parent So I was in very, very much need of financial resources when I went on to grad school. So these are just some of the things that are available at St. Augustine, depending on your situation, because each person at our meeting tonight has a different financial background. So at St. Augustine, we always recommend that a student who's looking at us is to have a one-on-one conversation with one of our financial aid counselors. So what they'll do is find out basically what is your financial situation. They'll want to know whether you have resources to pay for graduate school or if you don't. And based on your answer, they'll tell you what you qualify for. So of course, we have scholarships at the university. We have merit-based scholarships, which is just based on your academics. And then we have need-based scholarships that are based on your financial need or your financial background. So they will want to find out about that. And of course, we have the typical financial aid that's available. We have, they'll talk to you about loans if that's something that you need, or maybe you might have a military background, or maybe your parents have a military background. They'll talk to you about that. And then they'll talk to you about the deadlines that are associated with financial aid. Because of course, their deadlines are totally different than the admission deadline. So I would encourage you guys, if you're looking at St. Augustine, particularly as you become a senior, or definitely after you submit an application to St. Augustine, is to reach out to the financial aid office, and they will, again, find out specifically what your situation is. And then they'll tell you about what the university can offer you when it comes to support and comes to resources. Okay, before I play the video of the simulation lab, I'm going to take a break and see if there's any questions in the chat box, Stephanie.
No questions.
Excellent. So I've talked to you guys about the simulation lab. That's each one of our campuses. This is the hands-on teaching, the clinical part that I was telling you guys about. So again, as our students, as if you were in my class, as we got done with a classroom setting, we'd immediately walk across hall to our hospital, our clinical setting, and then you would apply what you learned in the classroom to a real live person. We hire people from the community. I've even acted as a patient on occasion because we want our students to get as much practice as they can on real people. So I'll play the video and I'll come back and give you guys some really helpful hints, and then we'll open it up to see if there's any more questions. You know, I think there's something, you know what, I think you guys might not be able to hear it. Tell you what, I'm going to stop sharing for a sec. How are we doing on time, Stephanie? Doing good on time?
We're good on time.
Okay, I'm going to stop sharing for a second, and I'm going to come back in because I think I forgot to put the volume part on. So I'll stop sharing for just a second, and I'll come back on.
Okay.
All righty, I think I'm ready. Okay, here we go. Let me know if you guys are not hearing it, but I think we should be okay.
For innovative clinical practice is an environment that really draws on experiential learning theory, that pulls in what the students have learned in the classroom and brought it to life through a realistic learning environment.
What we have here at the university is a space that simulates the environment of the clinical settings that you're going to experience.
That being an ICU center, that being inpatient rehab, that being a mental health clinic, that being a school system. So it brings those practice areas to life and prepares them.
And what that will do for you as a student is it's going to put you in the mindset that you are in that space. So you as a student are going to have a clinical simulated experience before you even have to go to the clinic. And I think that's a huge advantage for our program.
It's awesome. I mean, it's incredible because the more that we can get true to simulating what we're going to experience in a clinical environment and outside of school, the better that we can assimilate our practice, our application of knowledge. And it's incredibly valuable.
For me, the simulation experience here in this environment has been the most impactful portion of my learning here at the University of St. Augustine. It gives us that opportunity to, use our therapeutic use of self to address our bedside manners, right? Which is something that a classroom really can't teach you.
So the whole point of a simulation experience is to simulate real life. And in real life, occupational therapists aren't working with just occupational therapists, and physical therapists aren't working with just physical therapists. So this simulation experience allows us to create not only an environment, with a physical environment, but also have the other disciplines there.
I thought it was amazing. It was very interesting to see hospital environment in PT, because you don't really think about that when you're first going in for PT.
Well, I'm a very hands-on and visual learner, and so it's one thing to read about it in the textbook and one thing to talk about in the class, but to actually get in there and mess with some of the bed rails or the wheelchair locks adds that extra level to help us be better equipped.
I feel like it's important, even down to the smallest detail, to make it as real as we possibly can, because when these students are going into clinicals or hospital settings, they're really at the mercy of whatever walks through the door. But in a simulation setting, we can make whatever that instructor needs to have happen.
It's very lifelike, so you have to be quick on your feet and to really think through and draw on all of that information and knowledge that you've previously gained in your other classes and kind of weave it into one situation.
It brought in a lot of areas of the learning experience that aren't mimicked in a book, aren't mimicked in a lecture. So that was a really positive experience.
They'll tell you, oh no, their blood pressure's dropping, what are you gonna do? So they set you up for the scary scenarios so that they can see how you're gonna process it. And it's like a shell shock. And then you're like, okay, I've done this before, I know what to do now.
One of the greatest things is, in the end, we all come together, and it's called debriefing. We talk about it, we reflect upon it, we think about what we would do differently, what was great, and how we can apply it to practice.
Hey, hopefully you guys enjoyed the simulation lab. And I'm going to leave you just with some helpful hints, just as some things that no matter what your classification is tonight, be it a freshman or a senior, these are the things that are really going to hopefully take away some of the anxiety as you get closer to applying to PT school, because I know you guys have, I've heard like it's, there's so much out there to go through the process of applying to PT school. So if you can focus on these areas here, you're going to be in great shape. All you guys are bright, you're smart. Again, it's really identifying the school that's a good fit for you. And if you follow these, then you're going to find that perfect school. So the first thing you want to, of course, do is choose a major that you're going to excel in. Again, grades are not the only thing we're looking at, but you want to do well as far as your major with those prerequisite courses, and then, of course, your overall grade point average. And then you want to get involved with extracurricular activities. I know you guys are busy, just even taking classes, taking your coursework. It takes a lot of time to study and prepare. But if you can take a little bit more time for extracurricular activities, maybe doing, again, volunteering, some leadership roles, maybe getting involved in the pre-PT society as a club officer, because we want to make sure, or maybe even some research, because we want to make sure that you're able to balance multiple commitments. Because when you get in grad school, a lot of things are going to be coming at you from different directions. So if we can see that you can balance these extracurricular activities as an undergrad student, then you're going to be fine as a grad student. And then you want to gain as much practical healthcare experience, maybe an internship would be doing that, or maybe, again, observation hours or shadowing hours, or maybe working part-time. But as much healthcare experience as you can get is really going to be beneficial for you, because it's going to help you know that this is your calling, that physical therapy is truly your calling and what you want to do. And you're going to be able to talk to a lot of different people who've been where you're at now, and they're going to be able to share their experience with you, and they're going to give you nuggets to kind of navigate the process of going from an undergraduate university to a graduate doctor of physical therapy program. So again, find time to get as much healthcare experience as you can. Then you guys have a lot of great resources at UTSA. I met a lot of faculty people when I was there last week. I met some wonderful advisors that are in the health professions office. So you want to, don't be afraid to ask them for their advice and their support, because they've worked with a lot of students who are currently in physical therapy school, or students who've graduated from PT schools. So they have a lot of really good advice and support. So take advantage of that. So if there's an event or if there's an opportunity for you to gain some more experience, keep an open mind. and ask questions, because again, they're there to help you meet your personal and your professional goals. And then I think I mentioned this earlier, you always going to want to be ready to explain, why do you want to become a physical therapist? That's going to be the question that you're going to have in your back pocket, because everyone's going to be asking you that. So know, what is your unique story? What is your unique experience? What is it about the physical therapy world that interests you? Why do you want to become a PT? Because definitely when you get to the point of maybe being called to a school for an interview, again, we're not going to be asking you anything about your, maybe your grades or things that we see on your application. We're going to want to know more about you as a person. So you're going to want to be very up to date on maybe current topics in physical therapy. There are a lot of current topics, a lot of things that are going on with physical therapy when it comes to insurance and legislation type things. But you're going to want to know that. You're going to want to know, what is it about physical therapy that's bringing you there? And then I think I mentioned earlier, you're going to want to do your homework on each school, each PT school that you're applying to, because I know when I'm reading applicants, that's what I'm looking for. I'm looking for students who have done their homework on St. Augustine. And what is it about St. Augustine? Is it a particular specialization area that maybe one of our professors is teaching on, or maybe that's their background, or it might be the hands-on teaching, all those things like that. But so you'll have to find out the mission of the school, and again, what they're known for. And then last but not least, you're going to be hearing this word a lot as you come up to grad school. It's about being a professional type student. Now, I'm sure you guys are doing this already at UTSA, but I always like to mention it because as you get closer to applying to PT school, this is something else that I'm looking for when it comes to applicants. I'm looking to see that a student already has that professional demeanor. And it's very simple. It's nothing complicated. So when you start applying to graduate school or to a PT program, one of the things that you want to do is you want to make sure you check your emails on a regular basis, because a lot of schools are going to be communicating you and making announcements via email. And when someone emails you, you want to reply promptly to them, particularly if they're asking you for a response. Maybe they have a question about something on your application or something about anything that's related maybe to why you want to come to the university. You want to be very prompt. So that means you want to reply to them ASAP. That's a sign that you are coming up to the professional world. And then you want to make sure that you're prepared. So like I said earlier, you want to do your research on the school. You want to let us know who you are. You want to start networking, because networking is part of being professional. You want to start meeting people and developing those contacts. And then you want to have a positive attitude when it comes to being a professional person. So any person, anytime you're working with anyone from one of the PT schools, you want to have a positive attitude, because people respond to your attitude. So if you generally have a positive attitude, people will be positive back to you. But try to do that. Try to have that on whenever you're meeting with anyone. It's really going to help you not just with grad school, but it's going to help you when you actually go out into the real work area. And then last but not least, you want to follow through with what you say you're going to do. So if you say you're going to do something, make sure you do it, because that's part of being a professional. You want to follow through with all the things that you've said you're going to do, because all those things are super important, particularly as you start applying to PT school, because that's going to help you get over that final hurdle, and that's going to make us know that you're a well-rounded candidate. And then, of course, this is my contact information. If you guys have any questions, and I'll stop in a second just to see if there's any questions this evening. But if you have any questions as you're maybe in one of your courses tomorrow, or maybe you're doing one of your observation sessions and you think, wow, I didn't ask him that question, you always can reach out to me. That's my email address. And then that's my direct telephone number. You can call or text me with any questions, and I will be more than happy to help. So I'll take a break right now, Stephanie, to see if there's any questions, maybe in the chat box, or if anyone has any questions they want to ask out loud.
There's no questions in the chat box, but does anyone want to use their mic to ask any questions?
That means I did a wonderful job then, right?
We have one question.
Okay.
Why did you choose to become a physical therapist, and what's your story?
Well, believe it or not, I went to Texas A&M University as an occupational therapy person. So hopefully you guys won't hold that against me. But that's my background is in it's occupational therapy. So I practiced occupational therapy because my grandmother, when I was growing up, had work done. With both a PT and OT person, but I was a little bit more attracted to the OT area because I like the fact that they were getting my grandmother back to her daily living, to her daily activity. So that attracted me a little bit more. And then I decided that I wanted to teach. So I was on faculty for a long, long time at different universities. And then I decided to come over to the graduate school part of it. So now I'm no longer in the classroom teaching. I'm in the community partnership area at St. Augustine. So I do community development and community partnerships at the university, which is really neat. So I do all of the front part of this, making sure you guys are aware of all of the things you need to be ready for. So besides talking to students, I also work very closely with faculty members at UTSA and then also help professional advisors. So I spend time doing that. Every now and then I'll visit back with OT into the OT world. But again, hopefully you guys won't hold that against me with being an OT person rather than. Any other questions?
I don't think we have any other questions, but we won't hold it against you because, like you said, we have to learn to work with other professions.
Absolutely.
Thank you so
Absolutely.
much. Thank you so much. This is recorded, so if you ever need to reference this, it'll be on our YouTube channel. If you have any other questions, that's his contact information, and we'll also share it on our newsletter in case you guys need it. But other than that, I think you're done.
Yeah, I think the only other thing, again, I'm not sure if you mentioned in the chat box, we're taking attendance this evening from the link that's in the chat box. So make sure, if you haven't already, make sure you click on the link and complete the form, and that's going to count as your attendance for this particular meeting this evening. So make sure you do that, and then I'll forward that back on to Stephanie, so that she'll have a record of your attendance tonight. So if you guys don't have any questions, thank you again for your time. I appreciate you being with me tonight. And if you have any questions, please let me know afterwards. If not, then take care of yourselves and have a great rest of your evening. Okay.
Thank you.
You're welcome. You guys take care.
Thank you.